Eba Sydney-Ghana SDA, yen Health Department program I anyone in New Star. You've been following us all the way through, right from nutrition, ABC air. This month we've been talking about air, and we're privileged to have Dr. Amwa with us for the whole season. And we want to really appreciate you, Doctor. Say hi to your audience again.
No, thank you for inviting me and everything.
Yes. Thank you. We're so privileged to have you here for this whole season. And as we promised our audience last week, it's FAQ week. So we have a series of 5 questions that we want to ask you. And yeah, we'll get right into it if you're ready. So the first question reads, Doctor, I'm really interested to know whether there's any such thing as having too much oxygen in your lungs.
So the answer is no and yes. Okay. So let me explain. So for the average person that is like walking around or not humming, that kind of thing, there is nothing like too much oxygen, because oxygen from an iron outside, that is 21% oxygen, and then the rest is nitrogen and outside. If you want me outside, you are getting 21% oxygen. The only difference is altitude and some other few different sides to change oxygen concentration. However, you can only get, I say, 21% from whatever oxygen you're getting, and the body is good with that. But alcohol hospital, for some reason, you might be sick and you might need oxygen therapy. Maybe you have asthma, and that's when you have pneumonia or something like that. You put oxygen on you. That oxygen, sometimes it is not raising up to 100% to apply in oxygen. In newborns, especially premature newborns, you give them too much oxygen, it can cause what we call oxidative stress on the body, and they produce certain compounds. It will say on the brain and on the knee. For them, there's something like too much oxygen, because giving them too much oxygen will lead to these problems. Because of the oxidative stress, oxygen concentration at war on their bodies. But for the regular person who's moving around, who's just breathing in air, breathing the normal oxygen, there's nothing like too much oxygen. Your body, the air around is just 21%. See, no matter what you do, it's 21 plus or minus 1 creating. But essentially, you do what you do. So that's the thing. So that, yeah.
Okay. All right. Thank you. Well, then the next question would be then, does the size of your nose affect how much air you take in?
I think that, yeah, this question is really possible. So, the truth is that the truth is, the simple answer is no. So, and yeah, we make a say the better from other home, because if I'm not home in the one side, pass through your airways down through the tubes into the lungs, and then it does what's supposed to do. It doesn't really affect that much. The body to suit your face, to suit maybe how it doesn't really do and change anything. But what does the difference in woman as affect your size? Okay.
Oh, okay.
So the bigger the person's size now, so you will be out here 7 feet tall, and you'll be out here 5 feet tall. You're here 7 feet in, or you use a lot of oxygen than you're here 5 feet. You usually see this when you go to places like diving, so those diving spots and snorkeling and other things. We use to oxygen tanks. So when we are big people, of oxygen tank now, or dive here, they say 15 minutes time now, oxygen mask. Meanwhile, or your small body, bit married to that oxygen tank for an hour or over. It tells you, say, the size matters, because the bigger your size, the bigger your lungs, and the more oxygen you need to supply all the muscles and the big bones and everything. There is this thing out there, say, shorter people. I don't know if you have heard it. Shorter people live longer. And I mean, but there are some school of thought on who say that's because the shorter the person is, because it's short, the heart is able to pump blood to the feet. But your one on they do everything point blood to the feet because the person is too big. So size that's mad. I don't know the truth in that, but that's what is out there. But once the bigger your size, you suck into the oxygen. That will be outside.
All right, so I don't need a bigger nose.
You don't need a big nose. You find whatever you have right now.
All right, thank you for that. The next question is, throughout the series of videos, especially last week's, we talked about some of the symptoms being of asthma and COPD being cough. Is every cough a symptom of asthma or COPD? Like, how do we tell the difference?
Okay. So I think one of the most common respiratory symptoms is human beings we interpret the as problems. But the why is that I call a mechanism of your body fast to be at the end of the system. So like you did not a trauma. Now it call lungs. Your body will try to expel that by make MR. So you increase the internal pressure which push the food up into your throat so they can expel it. That's the whole idea of cough. But cough is you have different ways and are different types of cough. Mm-hmm. Some of the coughs are controlled central, which means wagging the mouth, moving mouth cough. Some of them are controlled peripheral, which means organs no immuno and initiate the cough centers mouth cough. If they are within TIS, when you have asthma and I will use COPD, the cough that you get usually is dry cough. It's not usually productive. Sometimes it's productive, but you don't produce that. Me personally, very clear when you have it. But when you get bacterial infection like pneumonia, you get productive cough. It's usually chesty or one of the say and I will be on my mind usually a yellow and I say, see, that's one of the difference amount to say, okay, this is probably this particular condition and that is probably this condition. The other type of cough, cough from mucha, and that's all what we are my mucha. An example would be TB. So TB no, the cough is chesty and then it contains blood because we develop hemoptysis and TB. The way maybe next time another decision don't quite have say want to be the decop vessels now a wall relaxing and it causes it to bleed. Into one now moves in much and they come with other something one comes of the bowa if you fit it and answer me sorti. Is that seeing these sentences? You start it, then one will say a chronic. You are what do I just short, but this is chronic and be long time. Once we start seeing all these things, I think they said this is more of TB cough. Lung cancer can give you similar cough. What we call GERD, and I said GERD, and gastroesophageal reflux disease. They say acid in what we about back through the esophagus. It can also give you cough. So the bad or also symptoms, if you say when you have pains. Over coffee 2-3 months and you realize that you are the cough not happening again. And I do not that acid not flow after the esophagus into the throat and then you take the throat to cough. So the cough the reason is because see a beer what are there cause and symptoms that come on any normal time they say we and cough with and cough with. See that's what I can say about.
Awesome. Thank you so much for that explanation. The next question is, Doctor, I really want to know what is the reason why a lot of doctors advise to go to a greenery area for best air?
Greenery area for best air.
Yeah.
Well, the truth is that when you go to a place that is green, basically you get oxygen from the plants, right? So the plants photosynthesis back to primary school, photosynthesis. And then the pollination, the transfer of pollen from the ash to the stem. That's photosynthesis. And basically, the way plants produce food for us, the excess is oxygen. But there is like high concentration of oxygen in the environment. In that place, when you stay, you get a lot of oxygen. So compare it to another place, emphasize in Honoma. It's not just oxygen and carbon dioxide, those are the big parts, but there's dust, there are a lot of net gases. Imagine say it's all these fumes and ecosystem in now. It's all part of the air. And when you breathe them, you get all these things in as well. And see, that's why we advise get a green place, a place family air fresh. You are family a very rich oxygen, a camera who feel this a body system also. Yeah. Would say everything say colleague but essentially that's what happens. So we advise get a green place, a place that is, it helps you because you are getting rich oxygen, devoid of dust and all these other particles, which will be good for your body. Yeah.
Awesome. Thank you so much. And the last question, very last one, is there a correlation between air and the spread of disease?
Correlation between air and the spread of disease. So yeah, there is a correlation between air and the spread of diseases. So also you see a transition of diseases. Let's say airborne disease, waterborne disease, foodborne disease, and other things, right? So airborne disease comes with droplets too. area I found from the flu. Example is an airborne disease, right? There were other droplets. Other disease. COVID was like more droplets, and I wore TB more. I found from these things, bacteria that cause it condition. They are carried in the air, and also sometimes they are carried within a small water particles that can be suspended in the air. These are droplets. And then once you inhale it, it goes down to your lungs, there is seeds, and then it starts. Yes, the air you breathe can affect the way as we transmit some diseases to different people. And you should be careful of the air you breathe. You will be area now one. Wear your mask, you try to protect yourself because the mask all breathing out can be problematic to you. And the side things that it's very important.
Thank you so much for that. And also anyone in the audience, if you have any of these conditions or any conditions at all about what we've been speaking about or something entirely different, please note it in the chat box, or if you want to reach out to us personally, you can do so. We have a group of dedicated pastors and elders that are willing to help however way that they can. And so this brings us to the end of our air season. Next is something different. It's rest. So Doctor, you can rest from us now. Take care, everyone. We'll definitely see you in other episodes. Thank you so much. Thank you, audience.